This video I want to do it for a long time, and it's kind of some hesitation in my mind, so still today I haven't opened up. This is about my childhood issues, what happened during my childhood. At the age of 13 14, till 13 14, I am a thin person, and 14 years onwards I started noticing some discomfort in my chest, mild pain also, and I don't want to remove the bunion even at home. I want to wear the bunion all the time, and slowly the psychological insults because of this chest enlargement during the adolescence started happening to me. During my school days, there is a small dress changing room before going to the physical education period. We had to go and change the dress there. Initially, I used to get a lot of sarcastic comments from my co-students. Then what I started doing is I wait for everybody to change the dress. Then I go inside and I remove my bunion, and I will change that physical education, that uniform, and go. It looks simple issues, but the deep-rooted psychological insults what I went through is not explainable. Small issues like this happen everywhere, and my father used to call me for the temples. In Indian temples, we need to remove the shirts in most of the temples. There's a big fight at home. I don't want to go to the temples. Nothing against God, but that removing the shirt in front of others makes me feel very bad. And then my higher secondary education, plus 1 plus 2, that is only studies, it went off, and I never learned swimming during these days, though I have a lot of opportunity, because a lot of that well will be there around my village, so everybody swim very well in my village. Even my grandmother swims very well. Then I started putting on weight in my tummy also, because when the chest is big, if tummy is is thin, it looks very odd. So it's not purposefully put on weight, but your mind trained to do it because you want to hide the chest issues. So that's the time where I started becoming little obese. And then the college life started. I studied in a PhD medical college in Coimbatore in Tamil Nadu, India, and there it's a common toilets. You had to go to the for bathing. We had to go to the common toilet. So to cross all the people's room and all the other seniors' room, and we had to go there. And I had to wear a bunion. I used to wear a bunion and go there till the toilet. Then I remove the bunions, because I feel very ashamed to go without the bunion in front of others. Then one senior called Dr. Balasubramaniam, he is a ENT surgeon now, ESI hospital. He called me, told, Karthik, there is a treatment for this. This is called gynecomastia. It's a male breast issue. There is a treatment for this. He was in final year at that time, so he opened the surgical textbook and showed me something called Webster's surgery. So this is the treatment for this. Why can't you meet a plastic surgeon? Okay. Till that time, I don't even aware. I don't even know whom to contact. I don't even courage to discuss these things with my parents. Then I approached my parents. They are also very much willing to help me, because even today I've seen a lot of people hesitant to take the kid for the surgery, but I'm lucky enough to have my parents who supported in this issue, and they took me to a plastic surgeon in Chennai. He's related to us also. He's a relative of mine. His name is Dr. Rajendran. He's a MMC professor at that time, Madras Medical College professor at that time, and he's a fantastic plastic surgeon. That's the first time I even exposed to the plastic surgical procedures. He showed, because his setup is a very simple setup. First floor is his house, ground floor the operation theater and 2-3 beds, and so we used to stay there, and food come from his home, and 3-4 days I stayed there after surgery. During that time, even showed all his plastic surgical procedures, what he has done, all the breast reductions, nose surgeries, and everything. That time the slide projector. He had a slide projector at home. He used to show us everything. The first exposure to plastic surgery. Though he's a fantastic plastic surgeon, that time available resources are less. There is no liposuction available that time, so only they make a half circle cut below the areola, and they remove the gland as much as possible. But same time they have to leave a little bit of gland so that it matches the nearby skin tissues, skin thickness. So during that time they keep a drain also. My post surgical experiences till today, if I think about it, it's not very pleasant one. Still when I move, the drain will move, each movement it hurts. Still 19 years only, still it's a kind of a kid kind of a feeling only. So each that movement of the drain will hurt you. So same time, that time my mother used to use a talcum powder, Pond's talcum powder, for putting my like back and all, to like we can't take shower for 3-4 days, so even that powder smell I hate it till today, because that not a pleasant time that smell came to me. So after the surgery I'm extremely happy, because that much amount they removed, and but still I am not very confident to remove the shirt in front of others, because there is a bulge in the sides, because only Webster's address only that area, it can't cover address the nearby areas, because that time liposuction is not popular or not entered into India that time. So a lot of small issues. I'm so happy, because 80% reduction is more than adequate for me. I'm happy, but still it's not 100% happy. That's what I can tell you. So I'm so happy that I'm become a plastic surgeon. Becoming a plastic surgeon is not my aim, but accidentally I become a plastic surgeon. But I'm so happy that I treated more than 2,500 souls like me who underwent all this trouble in their life. In fact, I learned swimming after I finished my plastic surgery only, because till that time I was very not confident in removing the shirt in the swimming pool. And it's a very rewarding surgery for sure. You come in the morning, same day, afternoon you will discharge. Only 4 hours issue. 4 hours you have to be in the hospital, and it's a very rewarding surgery. We need not go through all these psychological insults in the childhood. Even yesterday I operated a person. He is in contact with me for a long time, 2 years, but lockdown he has given him some time, so he came for the surgery. And the end of the surgery, I usually like when they're getting discharged, they come to the center, and I ask them to open the pressure garment and see the results. And he thanked me like anything, because that happiness what I'm giving to the client is definitely makes me so happy. That high you won't get it by anything. If you have this problem, don't hesitate to meet a plastic surgeon nearby area. They'll definitely help you. Don't hesitate to tell your parents. And same way, the people who underwent surgery with me, more than 2,500, they are on my Facebook, they are subscribed my YouTube channel. So speak about it. It helps a person like you. Definitely you can make them happy. Same way, lot of sad and psychologically very emotional stories we see in our clients. One guy around 19 years, mother brought him, and she said that he attempted suicide 2-3 times. Then only we realized his problem is the male breast tissue, the gynecomastia. Middle class family. He joined the engineering college but discontinued. He doesn't want to go anywhere. So we treated to make him happy and make the problem goes away. Same way, I went for a consultation in Bangalore. That time one person, North Indian, came in a hurry and said that, "Doctor, I want to go immediately, as fast as possible," because we gave an ad in a Times of India newspaper that time in Bangalore. See, the ads are to educate the people. That guy not even aware that there is a solution for this problem till that time. After seeing the ad, he was so happy. He's 35 plus, and he came and approached us. He has 3 kids, but he never removed the shirt in front of his wife till today. That much psychological insult this gynecomastia will give to the person. You have to understand this. Other man, probably around 50 plus, came urgently for a gynecomastia surgery. I asked why, what is the hurry at this age, kind of. He said his mother is sick. When she die, I need to remove the shirt to do the final ritual things in the burial ground. So I feel very ashamed to remove the shirt in front of others. Please do it. One other story, he is a 65-year-old male from Bangalore. He also wanting to go for the surgery, and I asked why this age you want to go for this surgery, sir? He said, doctor, during my childhood I am not well off. Then the family life, lot of commitments. At least at this age I want to correct it. This is very psychological insults all over my life. I want to get rid of it. He did the surgery somewhere in the afternoon, and he is at 5 o'clock. I went for the rounds in the evening. He's already tucked in the shirt, and he's ready for the discharge 4-5 hours after the surgery. So these kind of psychological insults everybody go through in their life because of the gynecomastia. Definitely it is easily treatable. Approach a plastic surgeon, they'll definitely help you. Thank you.